Women do not come in to have screening mammogram as they should. We only see about 65% of the patients who are eligible to have the mammogram coming and having the test.
Dr. Anat Kornecki is an associate professor at Western University and the breast radiology lead of the breast care program at St. Joseph's Healthcare in London. She is also the regional breast imaging lead for the Southwest Regional Cancer Program.
In Canada, the general recommendations is for women to start having screening mammography at the age of 50 every 2 years. For some women, these recommendations might be different, whether they have a strong family history or whether they have dense breast. We see a definite reduction in mortality rate since the introduction of screening mammography at the late 80s. This is a fact that nobody can argue.
Unfortunately, many women feel discomfort and some pain during traditional mammograms. The related anxiety plays a role in why many women are not coming in or coming back.
Usually, the description of those patients who are not happy about getting a mammogram is the pain. And sometimes their memory of the pain goes back to 10 years ago, when the technology was completely different. We are definitely moving in a direction of humanizing the patient experience with mammography.
Over the past decade, mammography technology has been evolving. The Senograph Pristina, designed by GE Healthcare, is a groundbreaking breast imaging platform designed by women for women, with comfort in mind, including rounded edges instead of sharp corners, a thinner image detector that requires less hard, cold material touching the patient, and comfortable armrests for women to lean on instead of conventional hand grips.
The whole purpose of designing the Pristina was to humanize the experience. We need this technology because 25 to 46% of women never go back for a subsequent mammogram. In fact, in Canada alone, there isn't one provincial breast screening program that is meeting their minimum targets. In the design process of the Pristina, we came up with a strategy, and it's called the 3 C's. It's around comfort, confidence, and clarity. Comfort for the patient so that they can be relaxed during their mammo, they're less anxious during their mammo experience. It's confidence for the technologist so that they can place the patient properly in the machine. And then it's clarity for the radiologist at the end so that those images that come out, she can feel confident.
Women associate compression of the breast, which is necessary to take optimal images, with pain. The Pristina Duetta is transforming mammography by allowing the patient to control how much pressure is placed on the breast during a scan, under the guidance and supervision of a technologist.
The Duetta was designed to give control to the woman. There's many women who don't come from their mammograms because there's this perception that it's going to be painful. But if you have control, that minimizes that entire concern.
So what we found is that I did not even expect is when the patient actually used the compression, they go with more compression than they would if it was the technologist.
It was very different from what I expected because I've been going as long as they've been available. And it was very easy, very painless, and very quick and gentle. I got to control the pressure. I had a little gizmo that told me that I could tell them when to stop. And I recommend it because it was so quick and painless.
This new wave technology isn't just about increasing patient comfort during screening. When an abnormality is detected, the mammography unit has the added capability of performing contrast-enhanced spectral mammography. It can also perform 3D digital breast tomosynthesis.
With contrast mammography, we get images similar to that of a mammogram, and we get a very good image of the breast, not only of the breast tissue itself, but also if there is a cancer, it will depict the contrast and will enhance and will be more conspicuous without any background noise.
Dr. Kornecki envisions a future where mammography screening is even less clinical and more a part of a healthy woman's lifestyle.
If it was up to me, I would remove screening mammography completely from the hospital. Honestly, I don't think that this is the actual environment for that. It can be in a spa center, it can be in a mall, it can be anywhere and the patient go and treats themselves for another reason. But at the same time, Just take the time, stop by, have the mammogram, and go on. Having a mammogram doesn't mean that you're sick. It means actually that you're healthy and you look after yourself.
Well, this is so available to everyone, and I don't know why people wouldn't do it, because it's easy to, and it saves your life. If you can do something in advance instead of waiting to hear that you've got something horrible, please do it. Yeah, this is so easy.
If we can encourage one more woman, one more daughter, one more mother, one more sister, one more niece to go for their mammo that perhaps they otherwise wouldn't have, and if we can detect one more cancer early and help them get the therapy that they need, we've done exactly what we've hoped to do.
For more information about mammography screening for breast cancer, please consult with your healthcare professional.